with another video. Today I want to talk about hospital birthing. A lot of people are now talking about giving birth in a hospital versus home birth. Stay tuned to this video to find out my thoughts on hospital birthing and to find out what I think about home birth as well. But please be sure to like, subscribe, and comment on this video and share it once again if you think it's good information. Hello again, my name is Sierrathebbdoula, and my legal name is Sierra Bazell. But I really want to talk about this because as a doula, I get a lot of questions from people, especially during this time with the COVID-19 going on, about giving birth in a hospital, if it's safe, if it's not safe. And I just want to say that as a doula, it's my job to make sure that people are able to have the birth that they want. So I'm not going to push anybody by being like, oh, you need to have a home birth. They may not want a home birth, and that's okay. But if you don't want a home birth, just know that you can still have a safe birthing experience in the hospital if you know your rights and you have a good provider and you know how to navigate the system. So I just recently wrote an ebook teaching people how to birth in the hospital, but I do want to give you guys some tips a little bit later after I've said my piece. Am I saying that you can't give birth at home? No, because it's your right to do so if that's what you feel like you want to do. But I'm saying that me as a certified doula through Donor International, I cannot attend your birth unless there's a certified nurse midwife present. Now, my thoughts on that, I don't really want to get into that right now because I do have thoughts, but I'm not going to necessarily share them. One, because I run a nonprofit and I can't really talk about anything political, so I'm going to keep those thoughts to myself. However, I do think that people should have the right to be able to give birth in the way that they want to do so. So if you want to give birth at home, go for it. If you don't want to give birth at home and you want to give birth at the hospital, you should be able to do that too. So I'm not going to tell you you absolutely need to have a home birth, and if you're not having a home birth, you're putting your baby at risk. No, I'm not going to say that because it's your baby, it's your body, do your thing. And I did not give birth at home. I would love to have given birth at home, and if I had had another baby, then I would give birth at home. But, do what you feel is right for you and your baby. So if you're going to give birth at the hospital, here's some things that I want you to be aware of. Number one, know your rights. You have the right to have good quality care. You are supposed to get care before, during your pregnancy, and after your pregnancy. You have the right to get care. So don't ever feel like you can't go to the doctor, or if something's happening to you, you can't call a doctor and you can't, or a midwife, and be seen by somebody, because that's not true. You have the right to be seen by a provider when you are pregnant. If you do not have insurance, you can get pregnancy Medicaid. Go talk to somebody. Call them on the phone right now. Due to the COVID-19, they may not be allowing people to come into the office, but you can call and try to get your pregnancy Medicaid set up, because you are supposed to be able to have the right to get care. Also, you are supposed to get evidence-based, research-based care. That means if something is outdated and is no longer supported by research, then they are not supposed to be able to do that to you. For example, episiotomies. A lot of people back in the day used to do episiotomies. They don't do those anymore, especially the younger doctors. They don't perform them unless there's some medical reason as to why they need to do it, and which often it's not, because what the research found was that allowing yourself to tear naturally was better than somebody cutting you. So you have the right to refuse that or any other procedure that is not based on research. And you can ask them, hey, why are you doing that? Can you tell me what the benefits are? Can you tell me what the risks are? You have the right to ask questions. Ask these people questions. Don't just let them do things to you. If you don't agree with something, you have the right to refuse any type of care that they're trying to give you unless it is medically necessary. If something is medically necessary, and if they can give you a reason as to why they're doing it, then you need to use your common sense. And if it's a choice between your life and dying, then you may not want to just be like, oh no, I'm just gonna let myself die. So don't do that. But you do have the right to say, I don't want something, or I don't want this done, or can we do something else? Do I have any options? You can ask questions and they are supposed to give you answers. Don't let them just do whatever they want without asking them questions. If you don't like it, say, hey, wait a minute. Why are you doing this? Do I have options? Can I do something else? Remember that you do have options. Also, you are supposed to have the right to be seen by some type of lactation consultant when you have given birth. So you've given birth and you want to breastfeed your baby or chest feed your baby, whatever you do, but you want to be able to nurse your baby. You can see a lactation consultant, and somebody's supposed to help you with that. So if you're having issues with it, you need to see somebody. Let them know, hey, I need to see somebody. If they're offering you formula and you don't want that, you can say, I don't want this. I don't want it. And if they can't give you a reason as to why your baby needs it, which most times they don't, unless there's some type of medical reason, then you do not have to accept it. So know your rights. Make sure that you speak up for yourself, that you are advocating for yourself. And if at any time you don't feel comfortable with something that's being done, call them on it. Let them know. You have to be your own advocate unless you have a doula. And if you can't get a doula in the hospital, my suggestion would be to get a virtual doula. There are lots of us, including myself, that work with people virtually and are willing to help you. So if you need a doula, I have a resource list that is available of virtual doulas that are willing to help you. If you need it, you can contact me. I will leave the information in the description box below. You can contact me and I will get you that information if you need it. So get you a virtual doula. If you don't have a doula, have somebody. Get your partner, your support person, whoever it is. Let them know you need to advocate. If I don't like something and I can't speak up, you say something. Also, I want you to know that just because you give birth in the hospital doesn't necessarily mean that you're going to have a C-section. I work with people at the hospital all the time. I see them, they go in, some have natural births, some get epidurals, some do whatever it is that they do. They use different pain management techniques, but I have not dealt with a person yet who has had a C-section. I know other doula friends who have, but I haven't. All of my doula clients have given birth vaginally. I'm happy about that because I was not able to do that. I had to have a C-section. Wish I had a doula. Maybe things would be different. I don't know. But either way, just because you're giving birth at the hospital doesn't mean that you're going to have a C-section. So I don't want you to go in and be scared and think that. But one way that you can ensure that things are done the way you want them done in your birth is to prepare and know what's going on. You need to know when you go to the hospital who can come in the room with you and who can't. Some hospitals may allow doulas and your partner. Other places may not. You need to know this stuff. Know the information that you need to know. just be on top of your game. You have to be prepared. It's your birth. Nobody else can give birth for you. Nobody else is going to be able to have this experience. And you don't want to look back on your experience and feel like you weren't prepared, or maybe there was something that you could have done differently if you had taken the time to prepare. So just make sure that you have your preferences. Make sure that you talk to people. Make sure that you ask the questions that you need to ask. I hope that this was helpful. Have a great, great, great day or night if you're watching it at night. And I will see you guys next time.